Hello all, I'm Naseem Chatiwala, a course developer and instructor with Summit Education Professionals, and today's blog is going to address staying healthy physically, socially, and emotionally. So, I want to talk a little bit about mindset. Now, Carol Dweck, she is the guru of this mindset, right? And we have fixed mindset, whereas we have the growth mindset on the other end of the continuum. So, what is fixed mindset? Fixed mindset is where we do something and we go in with a mindset that this is what it is, this is how it's going to be, and this is how it's going to be done. And if for some reason it did not work, it's just the way it's going to be. Versus the growth mindset is continuously thinking and growing and with our own creativity and with our own thought process, trying to get better at what we are doing. So there is no full stop in growth mindset. It's just that continuum of growing and going further. So the growth mindset, the way we age and the way we think about it. When we are younger adults, children, we have that growth mindset. Because if you think about it, when we started walking, how many times did we fall down? We didn't fall down and say, all right, I'm done. I cannot get up. I won't be able to ever walk again. We keep getting up, we keep falling, we keep getting up, stronger, more powerful, and trying to conquer the world. But as we age, what happens? In a mid age, this is where that growth mindset starts to wear down and the fixed mindset starts to come up. And then as we age, we get more and more towards that fixed mindset theory and we become less of that growth mindset. And I really encourage you to think more in the growth mindset where if there is a problem, if there is a challenge, we need to think about it as okay, how can we do better with this? How can I take this challenge and grow with it? Now, even if you have a growth mindset, we can have different tasks, and some tasks we can still be growth mindset, and there could be a task which could be a fixed mindset. And so we really need to recognize that. So, for example, my daughter, she does skating, she does volleyball, she does basketball, and she does many other sports as well. And she's 15. She has a growth mindset. So anytime she has a setback, she tries very, very hard to work on it and to do better. She doesn't just sit down with a result of failing. But what I have noticed is her mindset in different sports is different. For volleyball and for basketball, she has excellent growth mindset. But for skating, I feel she has fixed mindset. So if she kind of failed in an Excel or if doing something, she comes to me and she says, oh, she's not good. She's not going to ever get that jump in. And we have to really coach her to get her to keep trying and keep trying. So it's very important for us to recognize where we have that fixed mindset and how can we change that and bring it towards the growth mindset. Depending on where you are in your mindset, I think that also makes us be in which comfort zone we are, right? So everybody has a comfort zone. So if you are in that fixed mindset and you have been doing the same job and same patients and same setting, we are very comfortable with that and we like it because that's our comfort zone. We don't have to think about it. We don't have to challenge ourselves. But if you really are looking for that magic to happen, we really need to get out of that comfort zone. So when we come out of the comfort zone, what happens? We might be affected by other people's opinions. We might find excuses to not step outside our comfort zone boundary. And we may not have that confidence to take us outside the comfort zone. But some reason we are able to do that and we come out of that and we come out of that fear zone. Now you are extending your comfort zone. You're learning. You're acquiring new skills. You're dealing with challenges, you're dealing with problems. And that's what brings you into that growth zone where we have new goals, we have purpose, we have some meanings, and we are able to get outside our comfort zone for that creativity and learning to kick in which will bring you towards that growth mindset. Another powerful word, and I love this word, it's a simple three-letter word, yet. And this is another of Carol's pet peeves. If you have a chance to listen to her, she has some blogs and some of her speaking engagements on YouTube. And one of the word that she talks about is yet. And I absolutely love that word because a lot of times we have these challenges where we are unsuccessful, or sometimes we are working with our patients, and maybe we have not achieved the outcome that you and your patient had hoped for, but we always kind of tell it is not yet. So if a patient is not able to walk that X amount of distance in X amount of time, and the patient might feel disheartened about that whole thing, it's really empowering to say, all right, we have not achieved that yet. So I think that power of this word yet, and if you think about it in your own personal health, this is all about your emotional health, right? If we put it in as, all right, I was not able to do that yet, it opens up a whole new door of new things and new ways you could do stuff. That brings us to this next topic of emotional intelligence. So, what is emotional intelligence? It's the way we address our problems. So, if you think about yourself, if you made a mistake at workplace, or if you got some critical feedback from your boss, how did you handle that? Were you the one who became very self-defensive about that problem or that feedback? Or were you the one who was very open-minded, self-aware, and was able to address that problem or address that mistake and own that mistake? So if you were, that means you are at a high level of emotional intelligence. So what emotional intelligence is it's self-awareness of oneself and self-management. So you are able to set goals, you're able to make a plan, you are able to stay focused, and we work really, really hard to address these things. So next time if you're in a stressful situation, ask yourself, are you able to stay calm? Are you able to keep your emotions under control? Are you able to be aware of your own personal emotions? And then how do you read other people's emotions? Because this is all about emotional intelligence. So what they say is, if you did really well in school, is that your ticket to doing really well in your life? Probably not, because that's what they talk about is emotional intelligence. But the way you have your attitude, the way you respond to things, real life problems, the way you are aware of your own self emotions and how you address other people's self emotions as well, practice and experience. This is what is going to help you dictate how you're going to do in life. So emotional intelligence is a number one predictor of how you're going to do in life. Another big thing is, do you want to be the person who has their mind full, or do you want to be that person who has mindful attitude towards life? And the choice is yours, right? The choice is ours. How do we want to do this? And I would strongly encourage you to be more of mindful. So a couple of things that can do to help us be that mindful is meditation. So what does meditation do? We all know meditation is good for us, right? If I asked this and if this was a poll and you're listening, I would have 100% response saying, yes, meditation is good for us, especially us in healthcare. But then how many of us practice meditation? And I'm sure that number is very, very low. So all I'm encouraging is 5 minutes of your busy life. Get into open space, headspace. There are lots of YouTube videos. There are a lot of guided meditation videos or apps. But even if you do it for 5 minutes, that's all what I do. And it really helps me. What does it help me with? First and foremost, focus, attention, clarity in my thought process. It helps me appreciate other people. It helps me appreciate myself. It fills me with gratitude. And all these are just so important and so powerful for your brain to function really well. My other big thing is invest in yourself. It doesn't take money to invest in yourself. All it takes is thought process and time. Pick one thing that you really like to do. Invest your time into learning that and practicing more of it. It could be a hobby, it could be a passion, it could be anything, but just pick something and then set aside a me time for that activity. Another big thing, and I get sucked into this all the time, and so I'm learning about this myself, is it's okay to say no to others and say yes to your self care. There have been so many times where I think, okay, I'm going to exercise, or I'm going to meditate, or I'm going to do something for myself. And then a phone rings, or somebody calls, and I'll be like, all right, I have a few minutes right now, I can address that. But if you keep doing that over and over again, you have taken away from that investing in yourself. And we know what the repercussions could be. So we really need to get this habit of being able to respectfully saying no to other people. The other thing is take a self-care trip. It could be a very low self-care driving trip. So you don't have to spend too much money. You don't have to book those luxurious hotels. Or actually, with this pandemic, we can't even think about going anywhere, right? But even like a small trip, a weekend getaway, and just focusing on yourself, people who are important to you, it really helps with that reset button. And then get organized. I can't tell you how much this is important. And get organized, I'm not saying like literally that a category, everything has to be labeled and everything has to be in this perfect spot, OCD. We're not talking that way. But what being organized is, at least you know where your things are, which you need for your next day. Because that puts your brain at ease. It really helps you with that emotional health. Now, when we get into these habits, what happens? Like 1st January, we have this list of resolutions. We say, okay, January 1st, my New Year's resolution, I'm going to do this, this, and this. What happens on February 1st? Things are lost. We, for some reason, are not able to keep up with a routine or a habit. So foundation is important. Like if you just do something for a week, 2 weeks, a month, it's not going to help. We have to do something that is every single day. It has to become a routine. So use calendars, use your smartphones, set alarms, reminders, whatever you need. And I think I don't need to preach to this listeners right now because we all are healthcare professionals. We do this all the time. We tell our patients to do this, right? Make that routine. But when it comes to ourselves, that's exactly what it is we have to make this a routine. Sleep. Sleep is something really, really important, and we all know how important a good sleep is. Now, some people do have problems with sleeping. So you could get into taking a medication, which I honestly don't recommend as much. But I really encourage behavioral therapy, guided relaxations, meditations before bedtime, having a routine for bedtime, reverse psychology. Reverse psychology is where you're thinking, oh, I'm going to stay awake, I'm going to stay awake. And that works in the reverse way. And if nothing helps, you can also try some modalities like acupuncture or biofeedback. Nutrition, another big thing. It really, really is so important. And these are some stats which says about 1 in 10 people only eat recommended amount of vegetables and only 1 in 7 people only eat recommended amount of fruits. 70% of adults do not eat recommended amounts of fruits and vegetables. When we think about fruits and vegetables, we're also thinking about macronutrients, right? So we're thinking about carbohydrates, proteins, fats, and then we have all these numbers, calories, how much to eat, what to eat. But I think sometimes what we forget is micronutrients. And so I really encourage you to think about how many micronutrients are you taking and is that enough? Because again, that really helps us with our health. And exercise. I think we are all healthcare professionals. We teach our patients exercising day in, day out. So, who would be a better group of people to talk about exercises than all of us, right? But a very interesting study, which was done in 2015, and they had about 1,200 healthcare professionals. They found 76% of healthcare professionals do not exercise on a regular basis. And sometimes, and I used to be one of them too. I used to always say, oh, I make my patients do exercise all day long. I'm always standing, I'm walking, I'm doing things. If you look at my number of steps in a day, I easily cross 15,000 steps. So that's my exercise. But in true sense, is that really an exercise? Exercise is the one where you really need to work on that cardiovascular health. And so we really need to set aside few minutes, maybe 15, maybe 20, to do this high level cardiovascular exercises. I just want to finish up this blog with Charlie Chaplin's quotes because I find those are very motivating to take care of our health. And thank you for listening.